Good morning, good morning. So I'm going to talk to you today about reimagining cities from the ground up. The challenge of the 21st century is really the challenge of how will we reimagine and redesign more shareable and sustainable cities. Will we redesign our cities for the rich or for the poor? For people of color or for white folks only, as we've done in the past? For eco-haves or eco-have-nots? And who will have a say in how we redesign our cities? Will it be powerful elites or will it be everyday people? For the past 20 years, my research and scholarship has focused on these two critical questions. First, how do we create more just, sustainable, and smarter cities and schools? And second, how do we create more democratic models of civic and community engagement? Right now, from where I stand, we really don't have shareable cities. We have pockets of shareable cities, but we have too many places where we actually aren't sharing, too many communities that are not receiving these goods and services. Yet, sharing and caring, what Karen Anderson refers to as compassionate, Karen Armstrong refers to as compassionate sustainability, right? Plus, cutting-edge technology are the real keys to creating healthy, thriving, shareable cities of the present and the future. Now, let me get personal with you about why I don't feel like our current cities share enough and our current cities don't care enough. So this is Shanice. Shanice is one of my students who I have taught, mentored, care about, and love. What Shanice is holding in her hand is an acceptance letter to San Francisco State University. Shanice was the first person in her family, of course, to get into a four-year college or institution. And my colleagues and I had set up a network of distinguished institutions around the country, Stanford, Columbia, Harvard, UC Berkeley, that would guide Shanice along her journey. But Shanice was never able to take this journey because Shanice was shot, a bullet through the back of her head, killed in deep East Oakland while just sitting in her car, right? And this happens all too often. Just last week, I lost another student. Now, I'm a college professor who teaches high school students, so the high school students get college credit. Okay, just last week, I lost another student. Each year, 10 years now I've been doing this, teaching high school students, giving them college credit. Each year that I've taught, I've had a student get murdered. Many students end up incarcerated. In fact, this year, on the very first day of school, when gunshots rang out, this is in East Oakland, right, Castlemont High School, the students knew exactly what to do. When there's gunfire, students know what to do more than they know the Pledge of Allegiance. What did these students do wrong? Of course, the answer is these students have done nothing wrong. We all know that. The only thing that they did wrong is they were born in the wrong zip code. Each year, 3.9 million kids grow up in neighborhoods of concentrated poverty. That's 2.5 times the entire population of Manhattan. Of course, this is a global problem as well, as we know that 30 million children worldwide in rich countries are growing up just like Shanice in neighborhoods of concentrated poverty. Now, let me be clear. I want to make sure we're all on the same page moving forward. What I'm saying to all of you is no matter how hard these young people work in school, no matter how hard their parents try to get ahead, the single greatest predictor of their life chances, of their lifespan, of their command over resources is the zip code. This is a crisis. It is a moral crisis because there's no way I should be able to sit up here and tell you before the first day of school who's going to fail, who's going to succeed, what is their race, what is their gender, who's going to be healthy, and who's going to be sick based upon the zip code. But this is also a financial crisis, right? Because this is costing us over $60 billion in downstream costs by, what are we doing? We're building up the prison industrial complex. And when you roll healthcare into that, we're talking over $1 trillion that could be spent on upstream solutions, like building more sustainable cities and schools. Who would Shanice have been today if she were alive? Would she have been a doctor, a lawyer, a chemist, a scientist, maybe the future president of the United States? And how would a family like Shanice's find the critical social services that she needs in order for her to reach her full potential? For the past 10 years, my colleagues and I recently co-founded a nonprofit organization called the Institute for Sustainable Economic, Educational, and Environmental Design. And we've been working on developing tools, ideas, models that would be game changers in terms of the delivery of social services to low-income communities and people of color. We're talking about tools for communities to innovate and collaborate. We're talking about tools for cities to become smarter, communities to craft new social and political realities, and of course, so that community members can rebuild neighborhoods with urban planners and policymakers and entrepreneurs from the ground up. The problem as we see it is really simple. There's close to 2 million nonprofits out there, okay? But millions of people and families like Shanice are not getting the critical social services that they need. The average family spends 20 hours a week searching for social services, and they touch 12 social services a month. But the problem is navigating this is super complex, and people are getting lost. And the reports and the rankings of social services are highly inconsistent. The opportunity that we saw, of course, is that 91% of folks are carrying around cell phones and mobile phones. So we built a tool, a world-class mobile platform called Streetwise. Streetwise allows community members to, one, access resources in their neighborhood quickly and easily from a mobile phone, and to visualize service gaps, community health, well-being, and resiliency. How does it work? Say Candace is in 3rd grade. She has low reading scores and needs a tutor. The way that our system is currently set up, where would Candace go to get this information? Word of mouth. That's basically what happens right now. With Streetwise, now you have a tool. You can think of this as an open source Yelp for social services, where you can find the social services that you need, you can rank the quality of the social services, and you can share and connect the social services with family, friends, and the community. Recently, we've been approached as Obamacare is rolling out to use this tool with Obamacare so folks in low-income communities can find high-quality medical providers in their neighborhood. At the same time, this tool is also really powerful for visualizing community health and finding the flaws in public data sets. What you're looking at right now is the Alameda County's Department of Public Health. This is East Oakland. And this is what the Alameda County Department of Public Health considers to be grocery stores in East Oakland. You would think it's a doggone food oasis. But through our tool, Streetwise, powered by Local Ground, when you ground truth this community, this neighborhood with the community, what you find out is there's actually only one grocery store. And the rest of those dots that you saw were liquor stores. One of the innovative features of our tool is digital storytelling, so that we can share best practices across time and space, so that people in Detroit can be talking to people in Accra, people in Oakland can be talking to people in Omaha. So current tools that are out there on the market, like you've probably heard of walkability, There's also another amazing tool called Aunt Bertha. They do not measure sidewalk quality, the number of traffic lanes that a community person has, that a person in the neighborhood has to cross to get to a school or a healthy resource. These are things that only folks in the community and a community-driven data metrics tool can do for us. Or they don't tell us, as you just saw, the difference between liquor stores and grocery stores. The value added of Streetwise is that it creates democratic models of civic engagement. It gives communities a way to collect, analyze, and share data about transportation, bikeability, walkability, clean air, water. It provides a forum for grassroots activists to speak to treetop policymakers through chat rooms and other innovative ideas. And at the same time, it is one of the tools that will really help us create a truly sustainable and shareable city. The traction that we have so far is we have thousands of users across the state of California and beyond. We were recently approached by the Center of Active Design in New York, the New York City Department of Transportation, the New York City Department of Public Health about doing a potential project in New York City. There are 75 million people in the United States who need access to critical social services. That's 1 out of every 4 of us in this room will need to access social services either now or at some point in our lives, public services and social services. Wouldn't it be great if we had a tool that could help us do so, that could also help us be more politically and civically engaged, help us find jobs, parks, safe routes to school? Well, we do. The name of the tool is Streetwise, and our vision is to create sustainable cities and schools so people do not have to leave their communities in order to live, learn, work, and thrive. We're going to be demonstrating our tool tomorrow at 10 a.m. with a bunch of other innovative tools. I encourage you all to come on out and check it out. Thank you for your time.